Most men don't think about their prostate until something starts to change. It often begins quietly, waking up more than usual during the night, a slight change in how easily you can urinate, or a feeling that something just isn't quite right. And because these changes can seem small at first, many men simply ignore them, assuming it's just a normal part of getting older. But here's what's important to understand. After the age of 60, the risk of prostate-related issues increases significantly, and in many cases, the body begins to show early warning signs long before a more serious condition develops. In fact, medical experts have consistently emphasized that recognizing these early signs can make a meaningful difference in how these conditions are managed over time. The key is knowing what to look for. In this video, we're going to walk through some of the early signs of prostate problems that men over 60 should never ignore, explained in a clear and simple way. And if you find this kind of information helpful, take a moment to subscribe. This channel is here to give you practical, easy-to-understand health guidance so you can take better care of yourself as you age. Also, let me know in the comments where you're watching from. It's always great to see people from different places coming together to focus on their health. My name is Dr. Amba Carter, and I'll be guiding you through this today. Now let's start with one of the most common signs, and one that many men tend to overlook: frequent urination, especially at night. One of the earliest and most common signs of a prostate issue is a change in how often you need to urinate, particularly during the night. Many men over 60 notice that they begin waking up more frequently to use the bathroom. At first, it may seem like a small inconvenience. Once during the night might not feel unusual. But when it becomes 2, 3, or even more times every night, it can begin to affect your sleep and overall well-being. Now, this condition is often referred to as nocturia. And while it can have different causes, one of the most common in older men is related to the prostate. As the prostate enlarges, which is a natural process that can occur with age, it can begin to press against the urethra, the tube that carries urine out of the body. When this happens, it affects how urine flows and how the bladder functions. The bladder may become more sensitive, sending signals that it needs to be emptied more often, even when it's not completely full. This can lead to that repeated urge to urinate, especially at night when your body is at rest. Now, here's something important to understand. Many men assume this is simply part of getting older and choose to ignore it. But frequent urination is often one of the first signs that the prostate is beginning to change. And while it may not be serious on its own, it's something worth paying attention to. Another thing to consider is how this affects your sleep. Waking up multiple times during the night can interrupt your sleep cycle, leaving you feeling tired, less focused, and lower in energy during the day. Over time, this can affect your overall quality of life. So what should you look out for? If you notice that you're waking up more often than usual to urinate, if the frequency is increasing over time, or if it's beginning to affect your sleep, these are signs that your body may be trying to tell you something. This doesn't mean you should panic, but it does mean you should not ignore it. Simple steps such as monitoring your fluid intake in the evening can sometimes help. But if the issue persists, it's important to speak with a healthcare provider, because understanding the cause early can make a meaningful difference in how it is managed. The key takeaway here is this: frequent urination, especially at night, is not just an inconvenience. It can be an early signal from your body. And recognizing that signal is the first step toward taking better control of your health. 2. Weak or slow urine flow. Weak or slow urine flow. Another early sign that many men notice but don't always talk about is a change in the strength of their urine flow. You may begin to notice that your stream is not as strong as it used to be. It may feel slower, weaker, or less steady. Instead of a smooth, consistent flow, it might start and stop, or take longer to finish. Now, this can be easy to overlook at first. It may seem like a small change, something you might not think much about. But over time, it can become more noticeable and more frustrating. So why does this happen? As the prostate enlarges, it can begin to narrow the urethra. Think of it like a gentle pressure being applied to a tube. When that space becomes narrower, it becomes more difficult for urine to pass through freely. This results in a weaker flow. You may also notice that it takes longer to empty your bladder, or that the stream doesn't go as far as it once did. In some cases, men describe it as needing to push or strain slightly to maintain the flow. Now, this is an important point. Changes in urine flow are not just about comfort. They can also indicate how well your bladder and prostate are working together. If the flow is restricted, the bladder may have to work harder to push urine out. Over time, this added strain can affect how the bladder functions. Another thing to pay attention to is consistency. Is this happening occasionally? Or has it become a regular pattern? If it's something you notice more frequently, it's worth taking seriously. Again, this does not mean something severe is happening, but it does mean that your body is undergoing changes that should be understood. It's also important to avoid ignoring these signs out of embarrassment. Many men hesitate to talk about urinary symptoms, but these are very common issues, and they are often manageable when addressed early. So what should you do? Pay attention to changes. Notice patterns. And if the flow continues to weaken or becomes more difficult, consider speaking with a healthcare provider. Because early awareness allows for more options and better outcomes. The key takeaway here is simple. A weak or slow urine stream is not something to dismiss. It's a signal, one that may be pointing to changes in the prostate. And understanding that signal is an important step in protecting your health. Difficulty starting or stopping urine. Approximately 600 words. Difficulty starting or stopping urination. Another early sign that can often go unnoticed, or simply be brushed off, is difficulty starting or stopping urination. You may find yourself standing at the bathroom ready to urinate, but nothing happens right away. There may be a delay of a few seconds or even longer before the flow begins. And when it does start, it may not feel as smooth or controlled as it once did. In other cases, you might notice the opposite problem. You begin to urinate, but stopping the flow becomes difficult. There may be a feeling that you don't have full control or that the flow continues slightly even after you think you're finished. Now, these changes can feel subtle at first. You might not think much of it. But over time, they can become more noticeable and more concerning. So what's happening here? Once again, the prostate plays a central role. As it enlarges, it can place pressure on the urethra and interfere with the normal flow of urine. But beyond that, it can also affect how the muscles involved in urination function. Urination is not just a passive process. It involves coordination between the bladder and surrounding muscles. When everything is working properly, the bladder contracts and the muscles relax in a smooth, controlled way. But when the prostate begins to interfere with this process, that coordination can be disrupted. This is what leads to hesitation, difficulty starting, or trouble stopping the flow. Another factor to consider is how this feels psychologically. Many men describe a sense of uncertainty. You may feel like you need to go, but then struggle to begin. Or you may feel unsure if you've fully finished. This can create frustration and discomfort over time. Now, it's important to understand that occasional hesitation can happen for many reasons. But if this becomes a regular pattern, it's something that should not be ignored. It's your body's way of signaling that something has changed in how your urinary system is functioning. And like the other signs we've discussed, early awareness makes a difference. The sooner these changes are understood, the easier they are to manage. If you notice that starting or stopping urination is becoming more difficult, take note of how often it happens. Observe whether it's improving, staying the same, or gradually getting worse. And if it persists, consider discussing it with a healthcare provider. Because these changes are not just about convenience. They are indicators of how your body is functioning internally. The key takeaway here is this. If something that used to feel automatic now requires effort or feels different, it's worth paying attention to. Because your body is often communicating with you, even in small ways. Pain or burning during urination. Another sign that should never be ignored is the presence of pain or a burning sensation during urination. Now, this is something that tends to get attention quickly, because it's uncomfortable and often difficult to overlook. You may notice a sharp or stinging feeling when you begin to urinate, or a burning sensation that continues throughout the process. In some cases, the discomfort may linger even after you've finished. Now, unlike some of the other symptoms we've discussed, this one is less subtle, and because of that, it often prompts people to take action sooner. But even so, it's important to understand what it could mean. pain or burning during urination can be associated with several different conditions. One common cause is inflammation of the prostate, sometimes referred to as prostatitis. This can occur due to infection or other factors that cause irritation in the area. When the prostate becomes inflamed, it can affect the surrounding tissues and make urination uncomfortable. Another possibility is a urinary tract infection. While these are more commonly associated with women, they can also occur in men, particularly as they get older. Infections can cause irritation along the urinary tract, leading to pain or a burning sensation. Now, here's something important to keep in mind. Pain is your body's way of signaling that something is not right. It's not something to ignore or push through. If you experience discomfort during urination, especially if it happens repeatedly, it's important to pay attention. You may also notice other symptoms alongside the pain. For example, increased urgency to urinate, cloudy or unusual-looking urine, or a general feeling of discomfort in the lower abdomen. These additional signs can provide more context about what's happening. Now, it's important not to jump to conclusions. Not every instance of discomfort means something serious, but it does mean that your body is reacting to something, and that reaction should be understood. If the pain is persistent, worsening, or accompanied by other symptoms, it's important to seek medical advice. Early evaluation can help identify the cause and guide appropriate treatment. Ignoring it, on the other hand, may allow the issue to develop further. The key takeaway here is this: pain or burning during urination is not a normal part of aging. It's a clear signal from your body. And when your body sends a signal like that, it's important to listen, because addressing it early can make a meaningful difference in your comfort and overall health. Feeling like the bladder is not fully empty. Another common sign, and one that many men find frustrating, is the feeling that the bladder is not completely empty after urination. You may finish using the bathroom, but still feel like there is urine left. Moments later, you might feel the urge to go again. Or you may notice that only a small amount comes out, even though the sensation remains. Now, this can be confusing, because it creates a sense of uncertainty. You may find yourself going to the bathroom more frequently, not because your bladder is full, but because it doesn't feel fully emptied. So what causes this? Once again, the prostate plays a key role. As it enlarges, it can partially block the flow of urine. This means that the bladder may not be able to empty completely. Over time, small amounts of urine can remain in the bladder after each visit. This leftover urine can create the sensation that you still need to go. And as this continues, the bladder may become more sensitive, increasing the urge to urinate even further. Another important factor is how the bladder itself responds. When it has to work harder to push urine past a narrowed passage, it can become less efficient over time. This can contribute to that lingering feeling of incomplete emptying. Now, this is not just about discomfort. It can also have practical effects on your daily life. You may find yourself planning your activities around bathroom access. You may feel hesitant to travel long distances, or you may experience interruptions during the night. All of this can affect your sense of ease and confidence. It's also worth noting that retained urine can, in some cases, increase the risk of infections. So while this symptom may seem mild at first, it's something that deserves attention. What should you look for? If you consistently feel like your bladder isn't fully empty, if you find yourself returning to the bathroom shortly after going, or if the sensation is becoming more noticeable over time, these are signs that your urinary system may not be functioning as efficiently as it should. Again, this is not a reason to panic, but it is a reason to be aware. Simple lifestyle adjustments may help in some cases, but if the issue continues, it's important to speak with a healthcare provider, because understanding what's happening early allows for better management and peace of mind. The key takeaway here is this: that lingering feeling after urination is not something to ignore. It's a signal, one that may be pointing to changes in how your body is working. And recognizing that signal is an important step toward protecting your health. Blood in urine. Another sign, and one that should always be taken seriously, is the presence of blood in the urine. This can appear in different ways. In some cases, the urine may have a pink, red, or slightly brownish color. In other cases, the blood may not be visible to the eye but detected during a medical test. Now, seeing blood in the urine can be alarming, and understandably so. but it's important to approach it calmly while also recognizing that it should never be ignored. There are several possible causes. Some are less serious, while others require more immediate attention. For example, infections in the urinary tract can sometimes cause bleeding. Inflammation of the prostate can also lead to this symptom. In other cases, it may be related to kidney or bladder conditions. Now here's the key point. Regardless of the cause, blood in the urine is not considered normal. It's a sign that something in the urinary system is not functioning as it should, and because of that, it should always be evaluated by a healthcare professional. One of the challenges is that this symptom may appear suddenly and without other warning signs. You might feel completely fine otherwise. No pain, no discomfort, just a noticeable change in urine color. And because it can happen without other symptoms, some people may be tempted to wait and see if it goes away. But that's not the best approach. Even if it appears only once, it's important to follow up. Early evaluation allows for a clearer understanding of what's happening and ensures that nothing serious is overlooked. Another important point is to avoid making assumptions. Not all cases of blood in the urine indicate a serious condition, but it's not something that can be accurately assessed without proper medical evaluation. So the safest and most responsible step is always to have it checked. The key takeaway here is this: blood in the urine is not something to ignore, delay, or guess about. It's a clear signal from your body that something needs attention. And the sooner that signal is understood, the better the outcome is likely to be. Because when it comes to your health, early awareness is one of the most powerful tools you have. Lower back or pelvic discomfort. The final sign, and one that is sometimes overlooked, is discomfort in the lower back, hips, or pelvic area. Now, this type of discomfort can be easy to dismiss. You might assume it's related to posture, aging joints, or everyday strain. And in many cases, that may be true. But when it appears alongside other urinary changes, it can sometimes be connected to the prostate. The prostate is located just below the bladder and sits deep within the pelvic region. Because of its position, discomfort in this area may not always feel direct or obvious. Instead, it can present as a dull ache or pressure in the lower back, the hips, or the area between the lower abdomen and the thighs. Some men describe it as a persistent discomfort rather than sharp pain. Others may notice it comes and goes. Now, this kind of symptom is often subtle. It doesn't always interrupt your daily activities in a major way, and because of that, it's easy to ignore or attribute to something else. But here's the important part. When this type of discomfort is combined with other signs, such as changes in urination, it may be worth paying closer attention. It could indicate that the prostate is inflamed, enlarged, or under some form of stress. Another factor to consider is how the discomfort changes over time. Does it remain consistent? Does it gradually increase? Or does it appear alongside other symptoms? These patterns can provide useful information. Now, this doesn't mean that every instance of lower back or pelvic discomfort is related to the prostate. There are many possible causes, but it does mean that context matters. Looking at the full picture, rather than one symptom alone, can help you better understand what your body may be signaling. If the discomfort is persistent, unexplained, or accompanied by other changes we've discussed, it's important to have it evaluated, because identifying the cause early can make a meaningful difference. The key takeaway here is this: not all important symptoms are obvious. Sometimes they appear in ways that are easy to overlook, but your body often communicates through patterns. And when you begin to notice those patterns, you're in a much better position to respond, because awareness is the first step toward protecting your health. As we come to the end of this video, take a moment to reflect on what we've discussed. The prostate is not something most men think about on a daily basis, but after the age of 60, it becomes an important part of your overall health. And as you've seen, your body often provides early signs when something begins to change. From frequent urination, to changes in flow, to discomfort or unusual symptoms, each of these signals is your body's way of communicating with you. Now, the goal is not to create fear, but also not to ignore what your body is telling you, because early awareness gives you more options, more control, and greater peace of mind. If something feels different, persistent, or unusual, it's always worth paying attention. You don't need to have all the answers. but taking that first step to understand what's happening can make a meaningful difference. And remember, your health is not just about reacting when something goes wrong. It's about noticing the small changes early and responding with awareness. If you found this video helpful, stay with me. There's always more to learn when it comes to protecting your health and staying independent as you age. And sometimes, the smallest signals can tell you the most.